Today we are here to discuss about yet another important topic, that is preconception counseling. Preconception counseling is a counseling offered by the healthcare professional to help you prepare for the pregnancy. Imagine starting your most important journey of your life yet skipping the map. That's how most of the people approach pregnancy. Around 90% of the pregnancies are unplanned. Why is it important to have preconception counseling? In the modern recent trends, we have seen rising trends of infertility, delayed parenthood, and chronic medical illnesses. That there comes the part of preconception counseling to prevent any complication and ensure health for your pregnancy, for you and for your baby. Preconception counseling is not just a checklist. However, it's a lifestyle shift. We will be discussing about preconception counseling under two topics, that is preconception screening test and preconception health, nutrition and diet. Coming to the preconception screening test to be offered. For women, certain blood tests has to be done to ensure overall health. First is the complete whole blood count to check overall health, anemia and infection so as to ensure proper oxygen supply for the baby. Second is the blood group and Rh factor. In case of Rh negative mother, we should always check partner's blood group and the need for anti-D during pregnancy and even after the delivery. Next is the thyroid function test, that is TSH, T3 and T4 to assess the hormonal status as it affects the ovulation and also baby's brain development. Blood sugar levels also should be checked and ensure complete blood sugar control 3 months prior to the pregnancy. Anti-Mullerian hormone is a hormone to assess the egg reserve of the ovary and also to assess the quantity and the quality of the eggs. It can be done anytime during your menstrual cycle. Coming to the rubella immunity test. If you are not immune to the rubella, then vaccine should be considered and also to avoid the pregnancy for about 1 month. Next is the thalassemia testing should be done for the couple. In case of presence of thalassemia gene in both the parents, then your baby might be at risk of having the thalassemia gene and hence risk of anemia and need for the blood transfusion throughout life. Next is the pelvic ultrasound, a basic ultrasound usually to assess the uterus, ovaries and other pelvic organs so as to ensure the adequate growth of the baby. Coming for your partner, the basic blood tests which should be done for your partner include blood group and Rh factor, blood sugar levels should be done and also the semen analysis. Semen analysis is done to assess the sperm count, motility and morphology. Normal sperm count is around more than 15 million per ml along with 40% of motility and 4% normal morphology. The tests which should be offered as a couple screening includes the sexually transmitted infection panel including hepatitis B, hepatitis C, HIV and syphilis so as to ensure early detection of the disease and prevention to the baby against the infection and avoid transmission during pregnancy and delivery. Coming to the lifestyle changes which should be considered during the preconception part includes healthy diet and nutrition, avoiding more of processed food and eating home cooked food, maintaining the adequate weight, not being too overweight or obese, avoiding smoking, alcohol and stress and sleep so as to ensure healthy pregnancy, avoiding plastics and radiations and other environmental toxins, undergoing regular meditation and yoga to overcome depression and anxiety as it might affect your conception and pregnancy. So these are the basic tips which you should follow during your preconception counseling. Thank you for your patient hearing.